The Emergency Department Director of Emergency Services, Observation, Central Monitoring, Rachel Witgen. Rachel, welcome back.
Thanks so much. Glad to be back.
And Merry Christmas.
Merry Christmas to you.
Thanks. Are you all ready for the holidays?
I think about as ready as I can be. The 3-year-old and the 5-year-old.
Oh, wow.
Yeah, you know, how many days till Christmas? So they keep us on track.
Do you do, like, how many sleeps till Santa comes, or?
Yeah, things like that. Well, you know, now with all the devices, I feel like they bypass me. They'll ask Alexa, how many days till Christmas? Yeah. So, you know, that's technology helping us out.
Yeah, and it's possible they can even be ordering their own Christmas gifts.
Exactly.
Yeah.
I know. We've had to put some safe gates on there. I was like, what did we get? What's on our list? So.
Yeah, my grandson was buying apps on my phone a year ago, so
oh, no.
Unbeknownst to me.
That's right.
So the holidays, oh, by the way, congratulations. You are in a new position, same department, but promotion. Congratulations.
Yes, thank you so much. Yes, predecessor Anthony Jackson took a promotion within the healthcare system, so I'm really excited about the opportunity and pleased to be here.
Well, earlier today on the morning show, we had Dr. Jake Sinkoff, who is also promoted. He's taking over directing his team at the ER.
Yes, yep. Jake and I work closely together, and you know, it's fun because I think we both started as relatively new students and learning things within the same hospital. So to continue to grow there, I think says a lot, and it's a great partnership.
Awesome. Well, we hope that you have a quiet and a calm holiday season in the emergency department, but I know it's not likely to be the case. It's usually a busy time in the ER.
Yes, a very busy time. So, you know, we are seeing that spike in some of the respiratory illnesses, in addition to all of the holiday injuries, unfortunately, that happen with whether it's the decorating on the ladders or deep frying turkeys or, you know, snow shoveling and all of those things. So we definitely are seeing our busiest time of the year.
Yeah, read the directions too, because you might injure yourself putting something together, you know, rushing to get something done before Christmas morning, and oops.
Yes. Yep, oops. I mean, we're definitely here and open 24/7. You know, we don't close our doors at all, which is a great thing, but there are definitely opportunities for people to try to be a little bit prepared and aware to keep themselves out of the ED.
Yeah, we've had some really cold weather. Luckily, we're going to have a couple of days of reprieve, but that is when we see the uptick in cold and flu and RSV and even COVID, right?
Yes, definitely. It is our respiratory hot spot of the season, so we are seeing all of those traditional viruses that we've seen in years past. And I mean, really, it's just the simple stuff, hand washing, you know, trying to make sure that we're washing our hands, our kids are washing hands. And
I noticed, you know, with the holiday parties, when people have had a couple of drinks, they tend to get, they drop their guard, you know, and they tend to get closer to people and maybe talk in someone's face.
Yes, definitely, I mean, you know, there's behavioral factors and environmental factors that definitely impact the viruses and all of those illnesses going on as well. So just trying to make sure to keep your space when you can.
Yeah. We've got, you know, I think some things that one might experience that they don't know if it's serious enough to seek care or go to the emergency department. So let's talk about a couple of them. Breathing issues.
Yes. So really, you know, it's a case-by-case basis. But if you're having true trouble breathing, that is a medical emergency. Those can be situations where you need to seek out medical treatment from an emergency provider as soon as possible. But again, thinking about our, you know, older population and our younger population, that can be more severe. People that are of relatively good health and, you know, they're feeling a little under the weather, we have other great options such as our same-day clinic, the urgent care surrounding the IEP urgent care, even messaging through MyChart, your primary care provider, can be some great resources to know, what do I do next?
Yeah, I've used that, and it's really neat that you can communicate with your provider, and it's usually...
It's very, very quick.
Yeah. All right, heart. The heart symptoms, in addition to breathing, that can be a life-threatening issue.
Definitely a life-threatening issue there. Anything going on with the heart, chest pain, some of those pangs that you're shoveling snow and start to feel a little tinge of something new, definitely come and see us. We have very clean processes to make sure that we get those taken care of immediately. So.
And lastly, infections. Someone notices something unusual on their arm, and maybe they've cut themselves and they've tried to treat it themselves. How do you know at what point that, this is not going to clear up on its own? Yeah.
Again, I think working with, if you have a primary care doctor, getting their advice can be great as far as what are we doing next. But, you start noticing some discharge that it starts to smell funny, you're starting to have more fevers or anything along those lines that can tell you it's going a little more systematic than just a little cut that got infected. We're ready and willing to see you.
If someone says, you should have that looked at, that would be maybe a good
it might be, yeah, it might be a good indicator, for sure.
All right, we'll be outside hopefully, and people will get new sleds and snowmobiles and everything. What safety tips do you recommend for preventing sports or play-related injuries?
Yes, helmets. I think even with sledding, it seems like, carefree fun, but you get a little ice on some of those sledding hills and then some obstacles, whether it's trees or whatnot, it's definitely can be a hazard. So to maintain the fun, try to wear helmets if you're on some of those off-road vehicles, things like that. And then thinking about even the easy things like keeping your child in a big winter coat or snowsuit when you're putting them in the car seat, take those layers off. Make sure to have them maintained within their harness or their safety seat without all that extra fluff. Keeps them safe because fender benders and sometimes worse, unfortunately, MVAs happen around this time of year.
Yeah, and it can be a hassle, but it just takes a couple extra minutes.
Exactly.
Yeah.
Yep.
And we also, I think, broken bones, skiing, snowboarding, those kinds of activities, that definitely is an ER-worthy visit.
Definitely, yes. We do have some great opportunities with x-rays. They can do some basic x-rays at the same-day clinics. And then we have a great relationship with them. So if there is something found that is of concern, they can give us a phone call and then kind of give us a heads up that you're coming in for something that might need a little more attention.
So you mentioned the same-day health. When do you know? So if you've got a child or a young adult becomes sick or injured, when's it appropriate to seek care versus the ER, same-day care, or wait till you get into an appointment to your primary provider?
Yes. It can be hard, especially for people that are concerned for themselves, for their kids, to know where's the line, right? Where do I start? So the same-day clinics can treat some more mild and moderate illness and injuries. And if there's a question as to what's mild or moderate, a call to your primary care doctor can be very helpful in clarifying what route should be taken. But anything emergent or, acute, and this just happened, definitely come into the emergency department itself.
And if you're in doubt, that means do it.
Come on in. Absolutely. Yeah. Absolutely. We can still provide all the same services that the same day would.
Well, I hope that you have a light load in the ER during the holiday season.
Well, thank you so much.
Are you going to do a deep fried turkey yourself?
No. You know what? I think I'll leave my cooking to the husband. So,
all right.
But no deep frying anything.
Well, Merry Christmas to you and your family.
Thank you guys so much. I appreciate it. I hope we don't see you
in the emergency
department.
Yeah.
But I hope I see you, having fun with your family.
I hope we never meet again.
That's right.
No, I hope we see you soon, but not in the ER.
That's right.
Thanks, Rachel.
Here for you. Thank you so much.
Rachel Witgen is Director of Emergency Services, Observation Central Monitoring at Henry Ford Jackson Hospital, and is this week's specialist featured on Wellness Wednesday, presented by Henry Ford Health. Got a few things